Good day, I am Alessandra Denise DC Junicio, and for today's demonstration, I will be performing nasal swab. So, the first thing to do is, upon entering the client's room, we need to close the doors, the curtains, and the windows of the client to provide privacy. And then after that, we must make sure that we bring all necessary equipments and materials needed, which is which are alcohol, gloves, and the nasal swabs. Bringing all the materials needed will conserve time and energy of the healthcare provider. And then we must check the expiration date of the swab to make sure that we will have accurate result. And then after that, we will perform hand hygiene and wear PPEs if indicated. So for today, I will be wearing only gloves. But before wearing gloves, we must perform hand hygiene to prevent transmission of microorganisms. Then we will wear gloves. After wearing gloves, we will identify the client and explain the procedure. Identifying and explaining the procedure will build rapport and establish a comfortability while doing the procedure. So, good morning, ma'am. I am Alessandra Denise DC Junicio and I am your nurse for today. So, what's your name po?
Anjanette.
So, for today, I will be performing nasal swab, which will help you to identify and to detect or culture the infectious disease that occurring or you have. Oh,
Thank you.
after identifying the client that will receive the intervention, we will check the label of the specimen for patient's identification. The specimen has her name and birthday for identification. Checking the label with patient's identification will ensure that the right client is the right patient that will receive the intervention. So, your name, ma'am, is Anjanette. Okay po. So this swab is for the right client. Then, ask the client to blow her nose for making sure that there are no other mucosa secretion that can interfere the result. And it will also help to have accurate result. So, pwede po kayong suminga para po to make sure lang po na palinis po yung ilong for accurate result po para makakuha po ng mas maayos na specimen needed for the swab. Thank you po. And then, after that, ask the client to tilt her head up slightly to have better looking for the part wherein we will do the swab. And then, we will open the swab by making sure that we will maintain the sterility of it. So first is we will peel it off from the packaging and remove it from the packaging, and then open the swab or the swab packaging or the place of it. We should hold it. We will hold the tip of the swab and make sure to maintain the sterility of it. Then, put your non-dominant hand at the back of the client to assist the head, and then insert 2 centimeter of the swab to the first nares and rotate it to anterior mucosa 3 seconds to 5 seconds. It depends on the policy. So 1, 2, and 3. And then insert it to the other nares for accurate result and to make sure that we will attain the right specimen needed. So we will insert 2 centimeter again, and then rotate anterior mucosa 3 seconds to 5 seconds. Depends on the policy. 1, 2, 3. Doing this procedure will ensure accurate result. After we obtain the specimen needed, we will put it to the specimen tube, and make sure that it will not touch any surface to provide accurate result of the test. And then after that, we will dispose all the equipments we used based on the policy of the hospital. And then after that, we will put this to the sealed plastic and label it with the name and identification of the client, so that we will identify clearly which specimen is for the right client. Then after that, we will remove all the PPEs and gloves we used and perform hand hygiene. This will prevent transmission of disease. Then after that, we should transport the specimen immediately to the laboratory, because it will have accurate result. But because there are times that if we did not transfer it immediately, it will result a false result because the specimen is not accurate to the lab. And then if we cannot transfer it immediately, we can check for the instruction if we can refrigerate it for a little bit of time.